Welcome to Group Therapy as a psychotherapeutic modality. This is an overview of the history, application, and uses of group therapy. This is presented by Jackie Aragon, Trevor Gee, and Rebecca Wilkins, with Trevor Gee speaking. This is for Nurse 799, with Dr. Colosimo being the professor. Group therapy is a form of psychotherapy comprised of one or more psychotherapists working with several people simultaneously. Members interact with each other and the therapist. The therapist provides guidance and intervention. Different theoretical models are the basis of group therapy and depend on the type of group. Models include psychodynamic, cognitive behavioral, interpersonal, solution-focused, and person-centered. Most groups are homogeneous, or mean that they are dealing with the same type of condition or topic, such as anxiety, addiction, panic disorders, eating disorders, and depression. Patient outcomes are better in these similar or homogeneous group settings. Groups can be as small as 2 participants, but the upper limit depends on how realistic it is for the entire group to be able to participate. Groups of no more than 6 to 10 participants tend to have the best outcomes. Groups often meet for 1 to 2 hours a week, with a recommendation of attending at least 6 to 12 sessions for therapeutic outcomes to occur. However, there is generally no upper limit on most types of group therapy. Some examples of group therapy include psychoeducational groups, which are the most common and focus on educating patients and families on various mental health topics. Psychotherapy groups, which focus on treating deep-seated psychological problems. Support groups, which allow members to share experiences and provide sympathetic understanding to one another, such as grief and loss groups. Self-help groups allow members to share experiences and provide mutual support, with well-known examples being Narcotics Anonymous and Alcoholics Anonymous. There are various advantages to group therapy, including that groups provide an opportunity for social learning. Participants can learn and practice interpersonal skills with each other. Group therapies can provide a sense of community and commonality. Groups offer a diversity of perspectives. Groups are both time and cost-effective. There are also several disadvantages of group therapy. Not every person can be in a group, and some groups are better suited to specific people rather than to everyone. Confidentiality can be harder to maintain in a group setting. It can sometimes be hard to build trust in the group setting versus the one-on-one setting. Sometimes there isn't enough time to deal with each individual person thoroughly. Group therapy has a long history, dating back nearly a century. Formalized group therapy began to accelerate in the 1940s and 1950s, and many developments have occurred over the last few decades. Today, there is a large variety of group therapies that vary in function and purpose. There was no single creator of group therapy, but the table below shows key chronological figures and events related to its accelerated use. Feel free to pause and review the table at your leisure. In the 1900s, Joseph Pratt started group psychotherapy as a class for his patients with tuberculosis. In the 1940s, the military and military physicians used group psychotherapy as a means to efficiently treat psychiatrically disturbed soldiers after World War II. In the 1940s, Joseph Moreno developed psychodrama as a method of group therapy that allowed patients to reenact life events, which allowed them to manage anxiety-producing situations more therapeutically. In the 1940s and 1950s, Wilfrid Bion treated traumatized soldiers as collective groups, which forced the alignment of the group to work on the group's focus. In the 1930s through the 1950s, Samuel Slavson was the pioneer and founding father of the American Group Psychotherapy Association. In the 1950s, Raymond Corricini and Beanie Rosenberg completed the first systematic review of group psychotherapy and identified a number of crucial elements believed to be essential for the efficacy of group psychotherapies. In the 1960s through the 1970s, various psychotherapists developed new approaches to group therapy, including Bernays' transactional analysis method, Paris's Gestalt approach, existential group therapy, and group application of Rogers' persons-centered approach. In the 1980s, Aaron Beck developed cognitive behavioral therapy and created a CBT form of group intervention. In the 2000s, Irvin Yalom documented 11 core items or therapeutic factors that describe how group therapy works. Group therapy is widely used with different approaches for a variety of different purposes and functions. The different approaches and theoretical schools all have common core principles. The core principles have key mechanisms of change that can be organized into 11 foundational tenets, regardless of theoretical allegiances. There are 11 major principles of group therapy with corresponding patient attributes and therapeutic factors. Feel free to pause the slide at any time to review the table more in depth. The first principle is the installation of hope, which addresses the patient attribute of feeling defeated or feeling despair. The second principle is that of universality, which addresses the patient's belief that their problems are peculiar or shameful. The third principle is imparting information, which is thought to help the patient attribute of destructive thought processes. The fourth principle, altruism, is thought to help address the patient attribute that they believe they are unworthy of help or attention. Once again, feel free to pause the slide at any time to review the table below it with more in-depth timing. The fifth principle is corrective recapitulation of the primary family group, which addresses the patient attribute of past harmful and toxic experiences with their original group, which was their family. The sixth is the development of socializing techniques, which helps to address the patient attribute of chronic and maladaptive social tendencies. The seventh is imitative behavior, which helps to address the isolating and poor coping skills patients may have. The eighth is interpersonal learnings and self-understanding, which helps to address disconnection from others that patients may feel. Once again, feel free to pause the slide at any time to review the table more in depth. The ninth principle is group cohesiveness, which is thought to help address when patients feel they do not have a sense of belonging, as they can belong to the group or develop that sense of belonging within the group. Catharsis is thought to help address when patients feel they do not have a sense of safety or a safe place to express their deep feelings and emotions. The 11th principle is that of existential factors, which helps patients to address the deep pain they feel from life events. There are a variety of diagnostic categories best treated by group therapy, and we will address several of them. The first, psychoeducation groups, help to facilitate education or the imparting of information to patients or families about various psychiatric and mental health topics. Psychoeducation groups educate the group about psychiatric diagnoses, addiction, medications, self-care, recovery issues, and much more. Support groups focus on providing group members with an environment with others where they can share a common experience. Support group examples include grief, cancer, multiple sclerosis, diabetes, and many more. Self-help groups provide mutual support to their members. Examples of targeted categories include substance abuse disorder, alcohol addiction, and many more. Self-help groups are not usually limited to time, and participation can continue for months to years, usually with veteran members guiding and supporting the newer group members. These groups do not often use professional group leaders, as each member usually participates and leads the group. The scope of group psychotherapy is vast, and there are many diagnostic and symptom categories that group psychotherapy is appropriate for addressing. Below will be displayed a large list. Please feel free to pause the video at any time and review the list at your leisure. As discussed earlier, there are some disadvantages to group therapy, and there are also some reasons why group therapy may not be appropriate. It is important to screen and interview potential group members to determine if they would be a good fit for group therapy. Evaluating the patient's goals, the group goals, their motivation, ability to attend weekly sessions, past psychiatric history, intellectual functioning, past experience with psychotherapy, and personality characteristics can all help determine if the patient is a good fit for group therapy. Previous patients who have attended group therapy and did not adhere to confidentiality rules may not be a good fit for group therapy. Group therapy may be inappropriate for individuals who have certain types of antisocial, violent, shy, impulsive, or passive-aggressive behaviors. However, it is important to remember that if a patient is not a good candidate for group therapy, that they be offered other appropriate psychotherapeutic options. The role of the psychiatric nurse practitioner and group therapy. One example of the psychiatric nurse practitioner using psychoeducation group therapy is for those patients with major depressive disorder. The first step for the psychiatric nurse practitioner would be to evaluate and screen patients to see if they would be a good fit for the group. The second step for the psychiatric nurse practitioner would be dividing up the sessions to educate the patients on the disease process of major depressive disorder, including pharmacological treatment options, such as SSRIs, SNRIs, MAOIs, and other applicable medications, non-pharmacological treatment options, healthy habits, such as good sleep hygiene, proper diet, and appropriate exercise. The psychiatric nurse practitioner can use support group therapy for those patients who have recently lost a loved one. The psychiatric nurse practitioner evaluates and screens patients to see if they would be a good fit for the group, or if individual or other therapies are a better fit. The psychiatric nurse practitioner helps facilitate the group and allows patients to share experiences, as well as allowing members to provide sympathetic understanding. The nurse practitioner also provides education on common grief symptoms and misconceptions. In conclusion, Group therapy can be used to treat a variety of conditions. Group therapy provides an alternative treatment to meet the rising demand of psychiatric and psychological care. Group therapy provides a cost-effective treatment option. Group therapy increases access to psychological care by treating multiple people simultaneously. And finally, group therapy has been proven to be an effective psychotherapeutic approach and provides positive outcomes for individuals with a variety of both chronic and acute issues. Viewing our presentation and hope you have a wonderful day.